This is Dr.R.S.Sonawane, homeopathic psoriasis specialist. Lot of my patients with psoriasis ask me a question: does a children get psoriasis? Will my children have psoriasis? Let us discuss this. To be very frank, when I started my practice 40 years ago, in the books it was written that psoriasis is common in third and fourth decade of life, that is 30 and 40 years. Today it is written in the books that psoriasis is common or it begins in the year 18 to 25 of your age. So it has come down. But today in my practice, I find children getting psoriasis from age 5 to 10 or even smaller. Of course, children can get psoriasis because it is increasing. As we know that psoriasis is a genetic disease, it comes in your genetics or it comes from your forefathers. But this is not, genetics is not the only factor that will cause the psoriasis. There are trigger factors that cause the psoriasis, and these trigger factors are more now. It became more in young people and now it has become more in children also. So if you don't want your children to get psoriasis, you have to avoid them. And what are those? Lack of exercise, obesity, smoking and alcohol, irregular, highly fried, oily food, and junk food. These all things modify the immunity and they are the trigger factors of psoriasis. Lack of sleep is one of the trigger factor. And all these things are very common. Aerated drinks, this is also the trigger factors. And I need not tell you that these are the things common in children also nowadays. So if you don't want your children to get psoriasis, please avoid that. And psoriasis is also found in children nowadays. Be careful.